Operation of the device is very simple. There's a power button on the side of the device. If you press that down and hold it until the screen lights up, then let go, the device turns on. There's 3 points of connection that we check. We check where the cable plugs into the unit, and right now the display is telling you the cable with an arrow to the unit. The cable needs to be plugged into the unit. There's a red dot and a notch on the end of the metal end of the cable. This notch here mates with a keyhole at 12 o'clock on the female connector. You have to line it up. If it's not lined up, it won't go. Once it slides in, then press the whole thing in and it clicks in place. Now the device is looking for the pads, 2 pads to be plugged into the cable. It doesn't see them, so it's saying 2 pads with an arrow to the cable. On this end, the electrode can be plugged in. The orientation doesn't matter. It can plug in this way. It can plug in this way. You do not need to squeeze the prongs. They just click into place. Either electrode can be plugged into either connector. So you just push, it clicks. It purposely sticks out this far so you've got something to grab onto. So at the end of the treatment, you just grab and pull it apart. It's very simple to use. When these 2 electrodes are plugged in, now is the most important of the 3 error conditions. The unit shows 2 pads with an arrow to the body. If you're all hooked up to the patient and you see this error condition, it means the device does not see the pads on the body. It means the impedance of the skin is too high. So if you did not clean the skin first prior to treatment, then you need to remove the electrodes, clean the skin thoroughly with a damp towel, rub vigorously in the 2 locations that the electrodes are going to be placed. The rubbing action helps to exfoliate the skin, remove oil, lotion, dead skin cells, and what you've done is you've reduced the impedance of the skin. Now you have to also make sure that the electrode is tacky. If it's not, you need to use a new set of electrodes to ensure good conduction through the skin. If you clean the skin and the electrode has good adhesion, then this error condition will go away and the screen will start with 0.0. If the whole system is hooked up correctly to the patient, so the cable is plugged into the unit, the other end of the cable is plugged into the electrodes, and the electrodes are attached to the body, the unit should read 0.0%, and there should be no error conditions showing on the screen. If that's the case, you're all set to begin the treatment, and to begin the treatment, you simply start pressing the plus button. The screen shows the intensity. The scale goes from 0 to 100%. It goes up in 0.5% increments with each press of the plus button. If you hold the plus button down, after a couple seconds, it starts advancing at a faster pace, but not too fast. The lower left corner is the set time. It's preset to 30 minutes. The countdown timer's in the center, and the battery indicators on the other corner. When a patient starts out, they're going to increase the intensity of the signal based on the sensation that they feel. They should increase the intensity pressing the plus button to keep the sensation as strong as possible, but still comfortable. It's subjective, and it means something different to each person, but it should be up to tolerance, but the treatment should always be comfortable. So as the patient increases the intensity, within the first 3, 4, 5 minutes of the treatment, the body adapts to the electrical field and the sensation felt by the patient begins to diminish. As the sensation diminishes, the patient should press the plus button again to keep the sensation at a strong, steady level throughout the treatment. So, for example, it's a 30-minute duration treatment. 2 minutes into the treatment, if the patient's at 40% intensity, and this is for a static 30-minute pain treatment, if by the end of the 30 minutes, the patient should be at approximately 60% intensity. There's about a 20-point swing from the end of 2 minutes to the end of 30 minutes. The typical intensity reached by the end of the treatment for a back or shoulder tends to be between 40 and 60% of max intensity. For foot and for knee, foot, ankle, and knee, the typical range of intensity reaches 60 to 90%. Patients typically can tolerate more intensity in those regions. For the neck, for elbow, for wrist, hand, finger, it's more difficult to tolerate a greater sensation, so the typical range tends to be 30% to 50% intensity for those parts of the body. Some patients will go up to higher intensities, some patients will be at lower intensities, but that's the bell curve for those typical locations.